Astrius Catfox here, bothering you once again. I'm going to let people know I've changed my stream address. There we go. Hopefully that works. Woohoo. There we go. Okay. So, the actual part where I actually talk about things. Yes, today, hello, my name is Astrius Catyoti. I am here to talk about taking care of your aging pet, and that may mean cats or dogs, and I'll try and throw in a couple of other things while I'm at it. Just to give my usual spiel, there's going to be swearing. I swear a lot. I will try to tone it down. My version of toning it down is a little different than most other people's, so please bear with me. There's going to be some pretty sensitive words, such as syphilited donkey dick and you knuckle-dragging cockmuncher. So if you can handle that, awesome. If not, maybe tune out, I suppose. Have somebody else break it down for you. All of the stuff that I'm going to say is going to be based off of my own personal education and experience. Your mileage may vary. Every animal has its own individual needs. So if you have questions, feel free to drop them in the chat. Oh, that reminds me. Hang on a second. As always, I do have a charity going on right now. If it will post. Hello. Or it won't. Oh no. I guess it doesn't want to go. That's really weird. Error loading data. That's so peculiar. I don't know why it's not doing the thing. But anyway. I've posted it on my Twitter anyway, so if you want to donate to Doctors Without Borders, they're a really good charity. They're helping out during the COVID crisis right now in multiple stricken zones. So if you can, please help. If you can't, please don't strain yourself, because, I mean, we're all strapped right now, and I don't think that making it harder on yourself is a good way to go. So if you would help out if you can, being the big words there. Once again, mileage may vary. Always, always, always consult your actual veterinarian with your pet anytime you go to make any kind of decisions, choices, changes, etc. when it comes to your pet's health. With that, let's go ahead and get started. Ow. With me dying. Ow. Rat bastard. And seeing if I can do this without seriously injuring myself. How do I get in there? There's got to be... Ow. A way to not die while trying to also simultaneously get the shiny. Anyway, so... Ooh, ouch. I wonder if I can do that. That breaks that. Ah. So, taking care of your aging pet. That can look like... Oh, that just opens up right there. That can look like a number of different things. But let's start with diet, because diet's important at any life stage. It's important to make sure that you are getting the proper nutrition into your animal. When it comes to seniors, and for the age of senior, that generally means decreasing fat and increasing their fiber content. And I'll explain that in a minute. What I mean by senior when I'm talking about pets is very simple. For cats, that's usually past the age of 8 or 10, sometimes you'll see. But it's right around that particular mark. When it comes to dogs, mileage may vary very extensively depending on the breed. I wish it was easier to say than that, but it really is just a case of what kind of dog do you have. Because if you have a Chihuahua, their version of senior is very different than a Great Dane. Great Dane's lifespan is usually no more than 10 years max. It sucks. They're great, big, wonderful dogs, but they do not live very long. It's the same sort of thing with Bernese Mountain Dogs with, oh gosh, what are some other ones? Even Dobermans actually have a tendency to not live terribly long. I think the highest I've seen a Doberman is like 13, 14 if you're really good at taking care of them. But yeah, you've got dachshunds that'll literally 20, and that's just the breed. That's how they are. Ow. So did I already complete all of that shit? I did. I completed all that shit. But there's like shit up there I need. And I'm supposed to go down here. How the fuck do I? Alright, well, let's just keep exploring. So when you talk about senior pets, you're talking about an animal that has lived to a point where it is likely to start experiencing some pretty heavy life changes. Its metabolism shifts, and you've got dietary concerns to keep in mind. Their energy levels tend to go down. They don't move around as much. They may start to develop multiple different medical maladies that are pretty common. Things like hypothyroidism if it's a dog, hyperthyroidism if it's a cat. You almost never see a hypothyroid cat. You almost never see a hyperthyroid dog, but you will see these things on occasion pop up. Wait a minute. I just closed that. I didn't want to close that. Arthritis, diabetes. What are some other cool ones? Allergies to shit they didn't have allergies to before. It's, you'll just see these little things pop up. It's just like with people, where you just start to see these little maladies pop up that, will require the care of a physician to maintain and whatnot. Here, go break that for me. Thank you. Oh, there we go. Hey, a map stone. Now I can see where I'm going. Where am I going? Oh, hey, I need to actually put it in a map thing. Got the map stone, but I don't have the map thing. Oh, son of a bitch. I'm not going for that right now. So, there is a difference between senior and geriatric, and I'll get to that in a little bit. Senior animals, dogs and cats both, will need a lower fat content in their diet. So, you'll want to put them on a senior diet. Now, if you can find one that's built specifically for their lifestyle, or their, how do I do the thing? Is it that? It's that button. If you can find one that's specifically for their lifestyle or their breed or their size, for example, they have like puppy foods that are large breed puppy food, that sort of a thing. They'll have small breed puppy food. It's a similar sort of thing. If you can find a small or large breed senior, or if you can find a Lhasa Apso senior diet, or if you have a cat and you have a Persian or a long-haired cat with those kinds of needs, because they're more apt to develop Beozars, in layman's terms, hairballs. Or if you have an indoor-only cat and you get an indoor-only blend, it tends to have more chlorophyll, lower fat, and that sort of thing. So if you can find one of those are the best ways to go to take care of your pet in just bare nutrition. If you have an animal that develops an actual, honest-to-God, medical malady, like, say, diabetes, then you're really going to need to up your game when it comes to fiber. And part of that is because the protein content actually stresses the kidneys. And if you have an animal that's diabetic, the last thing you want to do is stress those kidneys, because those kidneys are already working a little extra hard to process the fact that the pancreas is not keeping up. So if you can get something with a higher fiber content, that is a much better diet option for a diabetic dog or cat. That's not to say forego the protein entirely. Obviously, animals do need protein. You need protein, I need protein. But you can usually find it in sources that are a little easier on. God damn! How do I get through here? On the on the kidneys. Oh wow! And I just went all the way back there. That's what I get for not saving. Wow! And I didn't realize I hadn't saved. So, son of a biscuit ballsack junior. Yeah, that's awesome. So, this is my life right now. All right, so, senior versus geriatric doesn't really change in terms of diet. Senior versus geriatric is pretty consistent. Did I do that already? I already did that. One of the things I like about the sequel, by the way, is if you shift one of these little levers, and it's one of those things, it's like, oh, I shifted this to open a door. It won't let you unshift it. Oh, hang on a second. Oh. Got feedback from my sound dude that I was breathing into the mic. No. Oh, hard piece. So, sorry. So when it comes to dietary care, that's pretty much it. So just make sure you're following your veterinarian's advice when it comes to their specific maladies, and put them on a senior diet. If you can specify what kind of diet to put them on, that's even better. You know what? Fuck it. I'm going to go down and see if I can't get that little energy burst. Completely lost track of what I was doing because I've completely messed. Oh, what? Oh, okay. Minor adjustments. So, other care in terms of making sure that your animal is comfortable. I know that we like to say have your animal see a veterinarian at least twice a year because they age basically twice as fast as we do. I mean, they seriously age out so quickly, and that's doubly true for senior pets. It's one of those things where if we didn't want your animal to be healthy, we would say, yeah, sure, go ahead, keep it home. But seriously, there are so many things that are so easy to miss. And this is going to suck, but I'm going to make some recommendations that are expensive here because they're best practice. So if you can do at least one annual blood work a year, just to check on those inside organs and as opposed to outside organs, just to check on those organs and make sure that they're all functioning properly and all that fun shit. That would be best practice. See your doctor, see your veterinarian at least twice a year, and get a blood work done at least on once a year. Because half the time, if you don't do that, we don't diagnose problems until they are severe problems, and I'm talking things like hypothyroidism or diabetes. Where, say, the diabetes has become so advanced that we literally... Oh, hello. Seen it before. Oh, plot point. Oh, this is something that is not in the original, by the way. This is only in the definitive version. Naru, that was the one that rescued you, if you were here from the beginning. Or was I? So, yes. Ah. Try not to die. Oh, no, those are spikes. Oh, okay, those aren't spikes. Oh, those are spikes. Okay. We don't usually find big problems internally until they become big problems. And part of that, and I hate saying this, is most specifically related to cats. Because cats are notoriously stoic little fuckers. I say that with all the love in my heart. And really and truly, I love cats. I love them dearly. There's 3 of them in my house that I take care of. But they like to pretend that nothing is wrong until they're literally falling apart now. And this is evolutionarily an advantage to them because when you consider the fact that cats are not just predators but also prey species, they have to make sure that they are not showing any sign of weakness whatsoever. Ooh. Dude, you just gifted light of this. Okay, cool. Okay, so I get to. Oh man, this is heavy. How do I. Oof. Oh, cool. Oh, this is going to be really difficult though. So cats will pretend like everything's fine. They like not showing any weakness whatsoever. They like saying I'm fine, even though their leg is falling apart. And they can be, as one of my veterinarians put it, literally crashing towards Niagara Falls and not show any signs until they're literally falling over the edge. Oh, I have a question. Yes. Cost on average for recommended visits for a senior animal. So there's the exam fee. Oh, I am so dead. I'm so dead. And I didn't get a chance to save before I went in here. Damn. So there's the exam fee, obviously, for any office visit. Sorry, I'm going to skip through this a little fast because I already saw it. But blood work itself is going to run you probably pretty close to $200. Now, I know that's a fair piece to pretty much anybody that isn't, I guess upper middle class or beyond. Because who has $200 to just throw around? But best practice. Because most blood work will look for things like how is the pancreas doing? How's the liver doing? How are the kidneys doing? Are we in a position to start looking at suspected cancers? Is the calcium too high? That sort of a thing. So if we get a snapshot of that and we get multiple points of data, that will help us determine whether or not an animal is developing a chronic problem, if they already have a chronic problem that we missed, or anything of that variety. So it is expensive. I'm sorry. $200 is nothing to sneeze at, for sure. Ow, son of a bitch. But it will really save you heartache and oh, I'm so dead again. Son of a biscuit-eating bastard. How did I even get over to the other place initially? Fuck. Does anybody remember? Shit. Bitch. Fuck. You know what? I'm trying to not swear, okay? So, where was I? If you can spare the 200 once a year to check on your dog or cat, that will give us, as the veterinary staff, a lot more to go on in terms of whether or not we need to start looking at various therapeutics, medications to help the animal not develop a certain condition. Or, you know what, I'm just going to go ahead and let myself die here. There. Now, how the hell did I go down here? Is that, no, because that's how I got up there. It'll tell us whether or not we need to put your animal on a specific diet, whether or not we need to start checking for arthritis, or not checking for arthritis, checking for other markers for things. So yeah, blood work is awesome and is really very, very useful in terms of diagnostics for keeping a senior pet at their top. The next thing is the exam itself is going to help because unless we could put hands on the pet and actually stretch out their legs and walk them through an entire exam, we're never really going to know whether or not they're developing things like arthritis. Arthritis is something that frequently affects older animals, specifically dogs, but it can happen in cats as well. Um, Older dogs in particular. Oh, yeah, right. Thank you. Because she was nice. Older dogs in particular, especially very high active, high energy breeds like Labradors, German Shepherds, um, very large dogs like Mastiffs, Great Danes, very subject, unfortunately, to things like arthritis. So if you can get a doctor to take a look at them, and can I fire this back at you while I'm carrying this? I can't, can I? Nope. Oh, that was stupid. Um, and then, of course, there's pain relievers that we can prescribe that don't cost too terribly much. There's non-steroidal anti-inflammatories that are safe for dogs and safe for cats. One of my cats is actually on a... oh, son of a bitch. She's actually on a pain management regimen because she has rather ridiculous arthritis in her hips. So, speaking of, that's her in the background if you can hear her. And that's not something that we would have noticed had she not gotten her regular exams and taken a look at those hips and legs. Radiographs. I don't necessarily recommend routine radiographs unless you have an animal that has known issues in that regard, like hip dysplasia or a torn knee, the torn cruciate ligament, as we call it. And if that's something, ow, bastard. If that's something that your animal has, then yeah, I would absolutely recommend preventative care radiographs. Things where it's like, oh yeah, your animal is already prone to this, so let's go ahead and oh fuck, and I'm dead because I can't jump while I'm carrying this. Fuck, 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 fuck. Glad I saved it right there. Woo! But otherwise, if you want to have preventative care radiographs done, if you want to make sure that you're not suddenly developing arthritis or something like that that's so severe that it's creating spondylosis, I mean, sure, go right ahead. That's not a bad thing. But radiographs are expensive. So consider that one. How expensive, you might ask? They're usually about 200 a go, sometimes 300 depending on the ow, 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 depending on the thing. The clinic. There we go. That's the word I was looking for. How do I go through here and not die? I don't understand how to go through there and not die. So I'm gonna just drop that for a minute. Ow. Fuck. Can I throw it? No, I can't throw it. Oh! I feel like a dumbass now. Whew. I can't... the whole thing is an unsafe zone. Alright. Whew. Made it. Oh, but that's not an unsafe zone. Go fuck yourself. Oh... Hit me, though! So, do I recommend them as a usual mode of care? No, I do not. Just because the cost prohibitions are pretty high. And it's a pretty small return for your usual average animal. Save it again so I don't have to jump through that mess. Wait, come back! Let's see, what else? Exercise. Exercise for your aging pet. Exercise is still very important. You know, play fetch with Fluffy. You know, play with the wand with your cat. That's totally fine. Point in fact, I encourage it because if your animal gets overweight, that increases their risk for things like diabetes. So you definitely want, if you are able, to woo, I almost bit it on that one. Oh wait, I've already been here. Son of a bitch. All right. Yes, please do continue to exercise your pet, but gently. Well, that was almost a total failure right there. Gently, gently, gently. You don't want to exercise grandma to a point where she keels over and dies. Same is true for your dog or cat. You want to make sure that you are exercising at a pace that does not cause joint problems, does not cause flare-ups in that regard, that does not exacerbate known problems. If you have a pug or a bulldog or any other brachycephalic smush-faced breed, please be aware of their limitations in terms of their ability to breathe. It's very important to breathe. So, you know, if you have an animal that's already struggling to breathe and you exercise the snot out of them, then, you know, that's not good for them. Oh, do I just drop it here? No, maybe no? Okay. I guess I'm not supposed to offer that to the statue. But you still want to keep them moving, because if you don't, they're liable to develop weight problems. They're liable to develop more joint problems, frankly, and other such situations. Then, oh, what the hell? You are out of your goddamn gourd. Are you serious? Oh, okay. Phew. Can I? Hello, tree? No. Tree says no. Okay. Tree's sleeping because it's dark. Oh, okay. That was my bad. So, gentle rounds of fetch. I wouldn't recommend tug of war. Neck pain, back pain, very common in dogs, especially, particularly in longer breeds. I'm looking at you, dachshunds. Back pain is rampant in dachshunds, as one might guess, because their bodies are unnaturally elongated. We have bred them to a point now where their bodies just aren't stable, really. So, that being the case, please try to make sure that you are exercising your animals responsibly and not to a point where they're going to exacerbate the problem. With dogs in particular, it's, actually with dachshunds in particular, it's known as IVDD, intravertebral disc disease. There we go, because I can talk. And that it's bad stuff. And surgeries to correct it are very expensive. Treatments can be helpful, but aren't always enough. So, I mean, you know, you want to try and be careful in that regard. Let me see if I will leave the light on this thing. Maybe I can. Oh no, because I'm going to need that guy and that guy. But if I... Nope. But if I go back to this guy. And then I can still climb up. Ha ha! I'm a genius. No, I'm not. Not even close. Oh. Oh, now there's a pedestal. Okay, where did my little light thingy go? Where did it... Hey, do I seriously have to go back and go get it? Oh, there it is. What? How'd you get all the way over here? I don't even understand now. So, let's see. Talked about diet, talked about exercise, talked about getting this little thing into the pedestal. Talked about routine checkups to include routine screening, such as shiny. Ow. Oh, sweet. I fixed it. Oh, now I can do this. Yay! I get to dash now. Right button. Okay. So this is the part where I got smashed. Oh, come on. I did the right button and it didn't do it. Is this right button? Is that right button? Wah-cha-cha. Yay! Peace out, bitches. Okay, so we've covered all that fun stuff. What else is there? There's a lot. What am I forgetting? Hang on. I'm trying to think here. Oh, what did I... Oh, it's a timed bastard. I hate timed bastards. Stay open. Ah! Whew. Got it. Alright, so let's see here. In terms of taking care of your aging pet... Shit. Shit. Oh god, this is fucking Indiana Jones. What happened? Why? Oh god, that was scary. Sorry about that. Unsafe zone, no shit. What happens if I do that? Cool. You may find that your animal develops a... Son of a bitch. Did that really happen just now? I can't get this anymore. Poopsicle. Maybe if I... Yeah! Alright, I can still get it. Yay! So now I don't know how to get up there. Shit. Maybe if I... Nope. Come on. You can do... You can do... Yay! Now I'll save. Oh, I still can't save. Okay. So, in terms of your pet's comfort at home, you may find that they become more sensitive in terms of people being around them. I already went through that? I'm so confused. Whose place? Oh, down there. Okay. You may find that they become more sensitive to noise, more sensitive to people being around. So if you have guests over and they start acting more shy, that's pretty common. You may also find that your pets are more sensitive to changes in the weather. You may want to put a warming place down for them so that they're a little bit more comfortable. You may also find that they don't groom themselves quite as easily as they used to or as thoroughly as they used to, which means that you will have to help them in terms of taking on that responsibility to help them stay clean, because a clean animal is definitely a happier animal. Oh shit, I can't get back that way now. Well, that sucks. Whee! So, for example, our cat Rose recently had surgery to remove her leg because she developed cancer. Sucks, but that's what it was. And so, that being the case, she found it harder to groom herself to a point, and now she's gotten to a point actually where she just really enjoys us grooming her, which is fine. Sunken Glades, I guess, is where I was headed. And she's very appreciative of it in terms of the fact that it actually helps her feel better about her own well-being and her own state of mind. So if you're looking for your animal to be happy as well as healthy, which I encourage because a happy animal is always going to be a longer lived animal than a upset one, then I would look at potentially upping their grooming. Now, some animals do not appreciate being groomed at all. That's just how it is. This is going to sound pretty cruel, but honestly, it kind of sucks to be them. So you have a choice to make. You can either force them to be groomed, or they can deal with not being at their peak health, which I don't recommend. Some animals do need to be held down for things like, say, nail trims. For older animals, I would honestly recommend a professional do it. I would not necessarily recommend that you do that at home, because I don't want you to have the animal feel traumatized by you, and I don't want you to necessarily accidentally hurt your animal either. So, with all of these situations involved, it's probably best that you take your animal to someone who can do a nail trim, who can brush out the mats, who can shave them if they need to be shaved, that kind of a thing. If you are able to do this at home, great. Please do. That is not at all a recommendation to not. Excuse me. Especially if your animal is able and willing to let you do this yourself. It will save you time and it will save you money. If you're unaware or unfamiliar on how to trim your animal's nails, it's pretty easy. There's several tutorials online that will help guide you through it. Cats are the easiest because they have basically clear nails. Dogs are a little bit more challenging because they have black nails sometimes, and black nails are really hard to actually see where the quick is, and you do not want to quick them if you don't have to, because that shit hurts. Ah, I can't get it. Shit. I have to go through this bullshit again. There we go. Oh, fucking. Alright. So we've got their physical well-being, we've got their mental well-being. We've got me dying repeatedly. You know, like you do. There is an unspoken part of this conversation that everybody hates, and I will breach it carefully. She does. She does love to get groomed. It's kind of nice. So I will breach this particular topic carefully. There is a time to say goodbye, and it sucks. Nobody likes doing it. We are here for you when that happens. But honestly, it's better a moment too early than a moment too late, because when your animal is suffering, they don't understand why. And if they are already in pain and suffering, and then they're being taken to a place where they are being euthanized, then it just compounds the issue. So if you can make the time to get it arranged, that's usually the best way of doing it. I will also state that having a care plan in place, for example, I want to have my pet's ashes returned to me so that I can make them into glass jewelry through a third party, and carry them around with me wherever I go, that kind of a thing. Or if you want to bury your pet at home, that's fine too. You know, those are all options. If you don't necessarily want to have the harsh reminder of your pet there, or finances are a constraint, there's always the option of having them cremated through a service, and having their ashes scattered over a field or in a forest. Our local place actually scatters them over farm fields. So there are options available to you in that regard. Whether or not you want to have a reminder or keepsake or not, have that plan in place before you need it. Because, oh really? Come on, little floaty thing. Because if you have yourself in a situation where you're looking at putting down your best friend, and then you're trying to make the plan and you're trying to make the decisions, and you don't have money set aside for it or something like that, it's gonna suck so much worse. So plan ahead. Knowing your pet is entirely up to you, so you will know probably when it's best to start looking at that as an option. If they are not enjoying themselves anymore, if they're not eating as much as they used to, if they just don't seem like they are really enjoying life at all, that's usually usually a good sign that it's time. We like to say you'll know when it's time. That's actually not true. You won't universally. A lot of people hesitate because they don't want to do it too soon. They don't want to feel like they've betrayed their best friend. I get that. That happens a lot. It happened just this past week. I had a lady who, honestly, her husband had to convince her that it was time, and it was, frankly, well past. It's, as my husband points out, it's almost never black and white. And, oh, Jesus. And that's very true. It's almost never black and white. And you have to be okay with knowing that it's going to happen without blaming yourself for making that choice, because it's your responsibility as the pet owner to prevent them from suffering any longer than they have to. So it's on you to make that choice. It sucks that falls on our shoulders, but it's also the kindest thing that we can do. So, oh, we've got another add-in, yes. Ah, yeah, that's a good one. Please stay for your euthanasias if at all possible. I've known a lot of people who can't handle it. I get it. I get that it's hard to watch your best friend pass away. But they always look for you. I cannot tell you how many times I have had someone say, I can't handle it, I can't do it. Well, that was smart. And it's like, okay, I'll take the animal in the back and we'll administer the medication. And the animal is always looking for the owner. Why did the owner walk out the door? Why did they leave me? Why am I in this room with these strange people? Why are they holding my arm? And why are they poking me with a needle? And then they black out. And it's not as stressful as not euthanizing them at all in most cases, because, I mean, you know, it could be that they're in acute renal failure and they are just 6 ways from Sunday going downhill. But please stay if you can, because it means a lot to them that you're there with them. I don't know how really to explain it other than the fact that you're their person. And they need you. And if you're not there at that last moment when it's most important, they know. And it's not something anybody wants to have to deal with. So if you can be there, please be there. I'm not saying put yourself in a mental state where you can't function, because that's not fair either. I just totally biffed it. You do want to make sure that you're taking care of yourself. I get that. Mental health is important. But yeah, it is just as hard on them as it is on you. I mean, they're saying goodbye too, even though they don't really understand the context. So if you can give them that reassurance, that last reassurance of, I'm here, it's okay, it really does make things a lot... I hate using the word smoother, because it's like... it is less painful. It's less stressful, I think, is a better way of putting it. So, I mean, yeah, if it's possible, please be there. Oh no, I'm gonna die. You little boogers. Just... Urgh. So, ow. Fuckers. Are there any questions I have... Yeah, death is never freaking easy. Trust me, I have been through... I don't even know how many euthanasias now. I couldn't even begin to estimate how many euthanasias I've been through. And not a single one of them has ever been easy. There's never been a time where I've been like, oh, that went smoothly. Or that went easily. And it's just like, no, this is not a good time. And it always sucks. And it always hurts. So, but it's always a part. Now, sometimes you're going to end up with an animal that's in acute distress, where you have, say your dog develops diabetes and you don't catch it because it just happened all of a sudden and it was in between visits, or you just didn't get around to getting him into the doctor and doing that blood work like you said you wanted to. because financial hardships happened. Um, that's okay. That's not your fault. You're not a bad owner. God help me, I can't tell you how many times I've had people say I'm a bad owner because something came up that they didn't expect and they didn't know how to prepare for. That's not your bad. Please don't ever think that. Um, but say your dog does develop acute renal failure, and all of a sudden you're looking at several thousands dollars worth of cost to get it fixed, if you can fix it at all. And you're overwhelmed, and sometimes that's a good time to euthanize the animal because fuck, maybe I should come back here later. Because I mean, there's a person attached to every animal, at least most of the time. Strays obviously notwithstanding, that's not their fault. But when a pet comes in, somebody's pet, somebody's friend, you have to think of you too. I mean, you're important in this equation. And if you put yourself in the poorhouse trying to treat something like acute renal failure in a dog, because renal failure in cats, if it's chronic, can be managed. If it's acute, you might be able to actually get away with some time. It'll be hard, no lie, but you might actually be able to buy them some time. But dogs, once they're diagnosed with renal failure, you've got a few months. And that's kind of all you got. What should I get? Ultra Stomp. Okay, that just sounds badass. I gotta get that. Pardon my hiccups, by the way. I downed an entire burrito in 10 minutes because I didn't want to be late for the stream. So, because I'm an overachiever. When it comes to aging animals, you have to consider pros versus cons. And that sounds... Yeah, burritos are good, man. It sounds heartless, but you really do have to take into account returns. Because when it comes to an older animal, say you've got a 16-year-old Chihuahua versus a 6-year-old Chihuahua, and they both come in same day, same signalment, same everything, except for their age. They eat the same diet, whatever, and they've both swallowed a sock. Okay, they both managed to lodge the exact same kind of sock. One ate the left, one ate the right, in their lower intestine. And you have to weigh your risks versus benefits for a 16-year-old dog versus a 6-year-old dog. A 6-year-old dog is almost certainly going to handle the anesthesia better, for one thing. A 6-year-old dog is almost certainly going to make a faster recovery. You might not need quite as much in terms of... I don't want to say pain control. What's the thing I'm thinking of? Like intra-op care, essentially. Like if you've got an animal that is sick or elderly, we almost always recommend putting them on IV fluids if they're under for any anesthetic procedure whatsoever. It's just smart. With a 6-year-old, you might be able to get away without doing that. So if cost is a concern, now you've got, that kind of situation where without IV fluids, you might have a much more hazardous outcome than were it a 6-year-old animal. So you have to prepare for for contingencies in that regard with older animals, like you don't with younger animals. So that's something that you have to keep in mind as well. Older dogs and cats tend to be more expensive simply by virtue of the fact that they tend to develop more maladies. So when caring for your aging pet, also remember to care for your wallet. You might look into various assistance programs in terms of things like there's a medical credit line out there called Care Credit, which you may or may not have heard before. You can actually use Care Credit for human stuff. I've actually had my dentist offered to use it for my dental work. You can use it for human dentistry as well as ophthalmology, as well as just sort of standard medical shit, depending on the provider. But a lot of veterinarians are starting to take care credit because it's frankly really hard to prepare for all of a sudden, oh no, my cat ate my child's binky toy and now it's lodged in his colon, and without emergency surgery right the good goddamn now, he's gonna die. So that being the case, there are programs like that out there for financial assistance, and I just locked myself in here again. I did that exactly same thing not too long ago. Back when I died the first time, after not saving at all. So care credit's a thing. I will also state for the record that pet insurance is not a bad idea. Not at all. In fact, I highly recommend it. If you can get pet insurance, by all means do so. Your mileage may vary in regards to how to do it. Some places will just have you charge it basically to them or bill to them, and some vet clinics often offer care plans too. Banfield is one of them. VCA is another. They're basically prepackaged healthcare programs. They're not the same as insurance. Don't get me wrong on that one. Insurance it's basically like human insurance where you pay a premium and then how am I getting all these map stones but finding no maps to put them in? Got 3 map stones and no fucking maps. Oh Jesus. Oh God. Oh bastard. So some places, in fact most pet insurance programs will have you go your visit and then basically send them your... Ow, that was the wrong button. Send them your invoice to be like, oh, hey, by the way, Fluffy had this visit with this service done, and I'd like to be reimbursed. And then they will, of course, break down what they cover. And son of a bitch, I keep hitting that wrong one. But I've heard a lot of people say a lot of positive things about it. It's much like with people insurance, it can be a little bit daunting because you've got situations where you're paying for a premium, and premiums can feel useless if you're just paying for them. And there's a fucking map. If you're just paying the premium, and then you're not actually, like, your pet's healthy. Trust me, it's better to pay the premium for pet insurance and not need the reimbursement than the other way around. You do not want to end up in a situation where you're screwed and you have to make the decision of either life-saving treatment or euthanizing your animal simply by virtue of cost. Nobody likes that. Absolutely nobody likes that. And I keep telling people, if we could do this for free, we would. Half the time, our cost is exactly translated to what we're being charged for things. So, like, the x-ray films, that kind of a thing. That shit's expensive, so it can be kind of problematic for us. Anyway, so if you can put a little bit of savings away for a rainy day in case your older animal gets sick, if you can put yourself in a position where you have care credit and you don't use it for anything else. Bonus points, by the way, care credit will not allow you to use it for anything other than medical stuff. So you can use it for, say, your teeth and your eyes and your own medical care and your vet's medical care, but you can't use it to buy groceries. It's not that kind of credit line. So, I mean, those things are options in case you need them. It's not a bad idea to have them, especially as your pet is getting older. So the instant that your pet hits, like, senior status, consider potentially looking into things like care credit. Just to be on the safe side. What other advice can I offer? We're right at about time at this point. Why are you... Ow! You asshole! Right underneath me and everything. Can you, like, come down here so... Oh, I need you over there, don't I? I don't know where to... That was smart. Land right on the spiky bits. Okay, I don't know where those things go. Oh, shit. Oh, no, that's good. I can swim. Nice. So we covered diet, we covered exercise, we covered habits and habituation, things like grooming and whatnot. We covered medical care. I think that's pretty much it in terms of advice that I have. This is actually a really good place to pause. Oh no. We'll get inside the dungeon and then we'll call it good for today. Does anybody have any other questions? Anything? Well, it did keep them safe. And here's where we'll save it for now. All right, well, thank you everybody for joining me. I'm going to be setting up a poll. I do not know if and when I will have internet access at my new place. I am moving, so bear with me. Keep your eye on Twitter. I will let you know when things pop up in terms of the next stream, etc. And we'll go from there. Okay? Make sure you vote in the poll. This will be posted to my YouTube, just like everything else is. Links are, of course, in my bio. And if you have any questions later, you can always DM me. Otherwise, thank you all for joining me, and have a good night.